Hello.
Hello,
Hello. Hello, my name is Emily Baxter.
I'm Dr. Aidan Giant.
I'm Teresa Petitucci.
My name is Tom Gillingwater.
My name is Dr. Lauren Clooney.
As I say to the students, you may be tired of hearing me explain it the way I explain it. You just need to hear another voice or a different accent or a different take.
So a mnemonic that I use to remember the order in which these structures are passing through the diaphragm and the level that's occurring is I ate 10 oranges at 12.
The key thing to do is to rotate the specimens when you're looking at these different cranial foci so you can see them in 3 dimensions. And you can see the 3 tiers quite clearly as I rotate this skull backwards and forwards.
Anatomy can be really daunting and just big for students, like gross anatomy by nature. So I think the learning outcomes are really good because it gives students sort of smaller chunks that they can divide their learning up, and it doesn't seem quite so nebulous for them.
The heart has pacemaker cells, and these are specialized cells that can contract on their own without any external nervous input. So they self-generate electrical signals and spread that wave of depolarization through the chambers of the heart and cause it to beat around 100,000 times each day.
From here, the spinal nerve divides further into a dorsal and a ventral ramus. And it's this ventral ramus that's connected over here with the sympathetic ganglia by means of a white ramus communicans.
The learning outcomes enable you to tie anatomy, form and function, and beginning to head down the path of clinical diagnosis, pathologies and common pathologies that we see.
Now, as said, with an inguinal hernia, we use the pubic tubercle as a reference point, and the protrusion was superior and medial in an inguinal hernia. But with a femoral hernia, the protrusion will be lateral and inferior, and it will definitely be inferior to the inguinal ligament.
For example, an upper brachial plexus injury, also called Erb's palsy, results from traumatic movement of the head into severe lateral flexion. Potential mechanisms of this injury include falling from height and, for newborns, the difficult delivery.